Good evening and greetings to everyone. My name is Kelvin Ampofo, and I am the 37th 2nd District Representative. On behalf of all the brothers of the 2nd District, certainly our Grand Bossless, Dr. David E. Marion, our first Vice Grand Bossless, Brother Ricky Lewis, and all the members of the Supreme Council, we hope that you and your families are well. Here we are again, here to bring you the great information and great updates we have as it relates to this pandemic. We're not going to waste any time. Let's go ahead and bring our doctors. Dr. Boykin, 78 GE. He always brings us that good knowledge, that good information. Good evening to you, my brother.
Good evening.
How you doing?
I'm doing great. How's everybody doing today? I hope everybody out there is being safe and enjoying what nice weather we've had in the last few days. So I'm doing pretty good. So
good. Let me give you your disclaimer, Dr. Boykin, so nobody tries to. All our guests, if you're joining us for the first time, certainly we have doctors here that'll be sharing some information. Please be mindful that the comments and views expressed by individuals tonight are their own and do not necessarily represent the views of the Omega Psi Phi Fraternity or any other entity that speakers may be affiliated with. So with that, good Dr. Boykin, please, obviously we got a lot to talk about tonight. We got Dr. Phillips backstage, but please go ahead and share your information with us tonight.
Okay, so everyone knows by now that we have fully vaccinated people can do just about anything they did before the pandemic. There are some caveats and some things that people need to do. So with that, I want to talk just very, very briefly about vaccinations. We know Pfizer has been the first vaccine that has been out there since the beginning in December, vaccinating people over the age of 16, and now fully vaccinated capabilities are available, I should say, ability to be vaccinated for 12 to 15-year-olds is now available. So now we have vaccinating people from the age of 12 on with the Pfizer vaccine. And so their studies show pretty good efficacy, 100% efficacy in their age group that they studied, and that their side effects were pretty much very, very, very small, and the same as those we saw in the adult population. But only less than 1% of them may have some lymphadenopathy, which means swelling of the lymph nodes in the arm and the neck. So I bring the point about because if your child has been vaccinated and they are complaining about swollen glands in their neck or under their arm, they should be evaluated, because we know children can get something called lymphoma, which may not be related to the COVID-19. Well, it's not related to COVID-19, but the lymph nodes may not be related to the COVID-19 vaccine side effects. So those lymph nodes should be checked out. And we understand today that Moderna is ready with their 12 to 15-year-old, well, actually their 12 to 17-year-old kids. The Teen Cove study that they have been doing, they closed it, but they're probably going to try to seek emergency use authorization sometime next month in the beginning of June. Johnson & Johnson studies are on the way for children in that age group, but they're not ready to bring forth any data. Now, Pfizer is also hoping that by September, they will have enough information from their phase 2-3 trials that children between the ages of 2 years and 11 years can be ready to be vaccinated and get the emergency use authorization. So those are the things that are on the forefront for pediatric vaccines. Now, having said all of that, we're not here to say you need to be vaccinated. That's a personal choice. But what I will say to you is that please take the information that we give you and make your own decision, because our goal is to give you informed consent. Because I'm concerned about the fact that we're opening up for fully vaccinated people, but it's on an honor system, and it's very, very important that people be honest about their vaccination, because we know this particular time of the year last year, we had a big surge because this is the beginning of the summer holiday season with the Memorial Day holiday coming up. So we know people are ready to get out of the house and do things. But please, if you're fully vaccinated, by all means, go ahead and do what you need to do, but still be careful. But if you're not fully vaccinated, please be honest and not go out and have the potential to spread the disease or get infected yourself. So those are the information that I have right now. We know that over 4.5 million children have been vaccinated, and 25 states have vaccinated fully vaccinated a half of their adult population. So those are great statistics coming out there. And the cases of COVID-19 are falling every day, but they're still out there, and we're still having deaths. Last week, this time, the death rate was about 600 per day. Now it's a little bit under 500 in some cases per day. So that's the information I want you to take from this tonight so far. And I want to be able to answer any questions later on. So with that, Brother DR, I will yield back my time.
Well, thank you so much, Dr. Boykin. As always, you bring it to us. I certainly have some questions, but we're going to hear, we heard from 78. We're going to hear from 88, Dr. Phillips, who's been doing a yeoman's job. I was just talking to him earlier today. He does his thing, obviously, in the hospital, does his thing when he's at work, but most importantly, he makes sure he does his thing for the community. Dr. Phillips, it's good to see you. Share some information with us, please.
Well, good evening, everyone. I think this being our webinar and we have a wider audience, I think tonight is critical. As Dr. Boykin alluded to earlier, this was the starting point of the surge that we really, started into things getting out of control. And I think, as I watched the Knick game, and again, as a Knick fan, I'm glad that we're in the playoffs, but it was scary watching all those people in there. And then, as you said, we're now on this honor system. And you're hoping that everybody's doing the right thing. But, again, you sort of shudder inside worrying about what 2 weeks from now we're going to look like in light of the fact that it appears that everybody is wide open. And again, I think to just underline what Dr. Boykin mentioned earlier, those freedoms are for people that are vaccinated. If you're not vaccinated, you should still be practicing those safety measures in all medium to high risk settings. So a couple interesting pieces of information. One, there was some data that came back from New Jersey looking at some of the populations that have not been as amenable or agreeable to getting the vaccine, looking at what their reasons are. Because again, unfortunately, we are still seeing that there are quite a few individuals that are not considering the vaccine at all. And as Dr. Boykin said, which I wholeheartedly agree, this is not to force you to do it, but again, to help you make an educated decision, because the data sort of speaks very profoundly as far as the results of vaccination and the types of liberties that it's starting to return to us. You look at the things that individuals who are vaccinated are able to do, but what do we need to do, or what do we need to be aware of as we try to lean in and have a conversation with these individuals that may be reluctant to get vaccine? What are some of their concerns? Some of the top concerns that they had mentioned were concerns about the drug maker and company, not trusting them. A lot of people were still concerned about vaccine side effects. Also, people still concerned about the rapid rate, at least from their perception, that the vaccine was developed. A lot of people, especially in Black and brown communities, have the question of, how do I get access? How do I go about getting a shot? In addition to that, people also have the question of, if I do get vaccinated and I have these chronic conditions like heart disease or diabetes, is this something that will be impacted negatively by the vaccine? And again, another issue with access to vaccine is people's concerned about whether it costs or not. And then last but not least, we are still dealing with the mistrust of large institutions and our government. So again, as we look at the conversations that we need to have as far as getting people to think about or consider the vaccine, these are some of the issues that we need to be compassionate to, empathetic to, and also willing to address. Again, another piece of data that I found to be very interesting, because again, there's been some recent talk of breakthrough cases. And right now, they say at the end of April, we had about 101 million people in the United States that were fully vaccinated at that point. And the concern was, are these breakthrough infections. I think a lot of people may have heard about the Yankees recently, where they had 7 staff members who were vaccinated and got sick, and or was infected with COVID. Now, again, all of these stories make people say, well, if I'm still going to get COVID, why should I get vaccinated? Again, the important thing is, number one, understanding what being vaccinated means. Being vaccinated, again, means that you're protected against serious illness, hospitalization, and death. It does not mean 100% that you would not be infected. So, again, as a person who is vaccinated, you could be in a space, not wear a mask, and unfortunately get infected with COVID. Even though you won't get sick, there could be someone else around you who may not be vaccinated, and you could give it to them and they could get very ill. Another thing, again, with this 101 million, they have seen about 10,000 cases, or what they refer to as breakthrough cases of COVID. What the definition of breakthrough cases is: a person that has a positive test after 14 days after they've completed their vaccination series. So what they found or seen with these breakthrough cases, a majority of them are mild and require no significant care, which again states that the vaccines are working, because again, like I said, the vaccine prevents serious illness. Another thing, as far as in that group, individuals that may have gotten a little more ill, they were older individuals. It seemed that a majority of them were over the age of 80. Again, you know, when you are in those vulnerable populations, significant multiple comorbidities, heart disease, diabetes, etc., age greater than 70 or 80, that is a population, unfortunately, that is vulnerable. And it's just why, going back to what was said earlier, that this honor system, to me, is very concerning because of the politicizing that we've seen with this whole issue of being vaccinated and people feeling that it's an infringement on their personal rights. However, you know, the way that I look at it is, me being vaccinated is a way, or me being vaccinated is a way to protect not just myself, but protect other people around me. Because again, we don't have a vaccine available for individuals under the age of 12. So what are they to do until that's developed? So the impetus is upon us to make sure we do our part to protect them. As was mentioned earlier and on our previous talks, individuals with immunocompromised diseases like lupus or HIV, or having a history of a transplant, even though you may be doing well from that standpoint, these are circumstances where the vaccine may not work as well. So these are individuals that may be vulnerable, and us adhering to these safety measures and adhering to this honor system that we're discussing, it makes it that much more important. Because again, Memorial Day weekend was the beginning of when things took off in the wrong direction for us. And if we do not want to see a repeat of that, we've got to get on this, because unfortunately, a bad sign that we have outside of the United States, already by May 26th, they have seen more cases internationally of COVID than they saw internationally in all of 2020. Now, what are the differences between those places and here? One of the biggest differences is the presence of the vaccine. So the other thing is, now we have leadership that adheres or supports the safety measures. So again, if we do not, you know, start to make sure that we adhere to the safety measures, adhere to the rules of regulations and rules of engagement, especially if you're not vaccinated, we can give the variants, which we don't want to mess with, a space where they can grow and become a bigger problem for us. So with that, I'm going to fall back and, you know, see what other questions may develop.
Well, as always, thank you so much, Dr. Phillips. So, I mean, let's just chime in on what you just said there as it relates to that variant. And I think one of the talks that's certainly been in the news, the discussions about a booster, Dr. Boykin, Dr. Phillips, those of us that are vaccinated, this booster discussion. I think Dr. Fauci was actually talking today about there will be some time where those of us that are vaccinated, we may, have to take a booster. Talk to us about, for those of us that are vaccinated, talk to us about the booster. What does that entail? What exactly does that mean?
So what the booster is going to mean is that we may need a additional level or dosage of vaccination to give us or maintain the protection and immunity that we have experienced thus far. There was a case, it was a gentleman who was in the first group of vaccinators, and actually his name was William Shakespeare, who actually died and from COVID, and he was vaccinated 10 months ago. Now, the only caveat to that was that he was over 80 years old, so still hard to say, does the vaccine work 10 months? But number one, I don't think it should be anything that's concerning, because we get the flu shot regularly for that reason, to address any variations that we may anticipate with the flu. So I think, again, that's something that should not be too troubling. Number two, this technology, especially the messenger RNA vaccine, the technology really puts us in the position where the development of booster shots is not a heavy lift or a difficult task to undergo. So I think if we had to do that, we're probably in a prime situation to do it without any hiccups or other types of negative occurrences.
I would agree wholeheartedly, and as Dr. Phillips alluded to, we probably are going to be looking at boosters down the road. But we know the data so far shows that if you're fully vaccinated, we are seeing cases of protection up at least to 6 months. So that's where they get the idea from 6 months on. But it doesn't mean that every 6 months you're going to get a vaccine. As Dr. Phillips alluded to, it means an annual vaccination. The only way that I can think that we will probably get every 6 months, if people don't do the right thing, if people are not honest about doing what they need to do and go out there and spread and be big areas of spread. So yes, there is already in the works. I mean, Pfizer and Moderna have been working on a booster, doing studies on boosters for a long time now. So we know that data is going to be coming out soon about that. And what they did, they took those people in the original group and re-entered them in the study for the booster. So we know now we have the vaccinated folks that went through the trial and came out, safe. And now those same people are going to be put in the trial or extension of the trial for the booster shot. So the data will be very great when it comes out. So I don't think it's anything to worry about. Often people ask me, well, I heard we're going to have to get boosters now. I'm 6 months after my shot. Do I have to get a booster right now? The answer is no, you don't have to get a booster right now. The answer is that probably sometime in the future, maybe on an annual basis we will, but not right now. No one's going to have to run out and get a booster shot as far as the data shows so far.
Dr. Phillips, Dr. Boykin, we know, we've said this before, we understand that unfortunately, we're not going to have 100% of the nation or the people that choose to get vaccinated. My question to you is this: for those that are still not vaccinated, and I'm not talking about the people that aren't vaccinated and they're not going to get vaccinated. I'm talking about the people that are not vaccinated that are still on the fence. Those people that are saying, I've gone this long. It looks like everything is opening up. It looks like the cases are going down. Maybe I'll be okay. My question is, are unvaccinated people, are they safe right now?
I'll jump in on that.
No.
Actually, I read an article today that said, as a person who's unvaccinated, your risk is about the same as it was back in January of this year. So in January of this year, we were right in the middle of a high point of the winter surge. And I think on January 13th, we might have had 3,600 people die on that day. So with that being said, I don't think that the risks are acceptable. I think the risks are great. That's why I just use the imagery. And again, I'm a Knicks fan. I'm a sports fan. I'm a social fan. And just seeing from just watching the playoff games, just the amount of people, and they don't all look like they're in the same, household or coming from the same space, so there, unfortunately, again, now we're back to that waiting period for 14 days to see if the numbers start to go up. Because remember, cases go up first, and hospitalizations, and then unfortunately deaths. And we don't want to see that. I mean, I think that, again, if I was unvaccinated, first of all, that's why I got done with this early, because I can understand why people are concerned, why people are hesitant. But I think that, again, as a person who would be talking to them as a healthcare provider or as a community that's trying to do an intervention, you've got to lean in and find out, well, why are these people hesitant? What has happened? Do they have some type of experience that may be triggering that? Maybe they have some questions that they've answered for themselves, but answered incorrectly, and they need good information. So again, I think that we've got to be compassionate, considerate. But I think the other thing that we've got to do, which we have done as a fraternity throughout this, is we've got to take advantage of the fact that we are trusted people in our community. And I think us being transparent, not just with information about the vaccine or the pandemic, but with our own hesitancies and our own points when we got vaccinated. And for some of us, even when we've gotten our family members, including our children, vaccinated. I think, again, you look at these groups as far as the data they're trying to accumulate now on people's hesitancy. A lot of things they talk about, especially with the younger people, they don't necessarily respect the leaders in the community like that. They more so respect people they engage with on a regular basis. So a family member, a friend, a coach, somebody that they may encounter on a regular basis, given that level of transparent testimony, I think will do wonders as far as, again, making that person say, maybe I need to, reconsider. I think another thing that you've got to do if you're in that position to discuss it is connect the dots for them. A lot of times when you connect the dots, because again, everybody's making what we call it a personal decision. Personal implies a level of selfishness and really not looking at the bigger picture. And again, when you look at it, make it a personal decision, at least for me, I had to look at my wife and kids. I had to look at my village behind me of people that if I said, man, I ain't messing with that, I know they not messing with it. So those are things that I had to jump in and do early, because I knew what was coming down the road. And I actually feel pretty thankful that I don't have to be in that position right now of should I stay or should I go? Should I jump in? I'm doing this double dutch right now. But I think, again, I think we've got to be, compassionate and empathetic, because these are not dumb people. These are not people. These are people that we love. These are people that we spend quality time with. These are people that we want to spend more quality time with. But again, for whatever reason, and everybody's got a reason that may be legitimate to them, and we've got to hear it out. I think it's important for us to make sure we don't get frustrated, because I'm sure each of us, and we've either seen personally or, experienced or heard about how this discussion of getting vaccinated or not has really become sort of a stigmatized issue. And I think, that makes it unfortunately uncomfortable sometimes to talk about. And when it's uncomfortable to talk about, you might be stuck with your input from Dr. Facebook or Dr. YouTube, other than the 2nd District Omega Psi Phi YouTube channel. But again, you might be in that space where those influences may be making you make a decision. And like we all know on this screen right now, we just lost a brother last week who was 40-something years old, not an old man, a young man with a vibrant future in front of him, with a beautiful family. And now all of that is different. And this young man had COVID before. So he felt, hey, I got through COVID before. Why wouldn't I be able to get through it again? And what we have said throughout, Dr. Boykin, myself, the other members of the team, COVID has an unpredictability factor. So even if you might have got through it once, or you might have been not infected in a year and some change, it still can pop up on you, and it can still come down real strong.
So I'll just add to that a little bit, Doctor. Following Dr. Phillips on that is going to be very, very difficult because he said it all. He said everything that needs to be said about it. But there's a couple of things I want to say about. One, I can sit up and say, look at the data. Young folks are dying. Forget the data. Young folks, watch the news. And since you want to watch the news, look at how many people are dying. You don't hear them saying, well, the nursing home over on such and such street had an outbreak of COVID, blah, 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 blah. What you're seeing is that people are dying of COVID-19 disease that are your age group in your sphere of influence. And those are the ones that are dying. So I don't need to sit here and try to tell you what about it. But I tell you, myself as a cancer survivor, it was very, very important for me to get the vaccine. And I think Dr. Phillips got the Pfizer and I got the Moderna. So you have an example of two doctors of two different vaccines out there. And we did just well with it. Yeah, I had some side effects from the second shot of the Moderna, but it just meant that my body was doing what it's supposed to. It made me feel good because as a cancer survivor, I knew that my immune system is still doing what it needed to do to protect me against that. So everybody that's out there, if you're one of those that undecided and you have a condition such as that, you're a cancer survivor, or you have sickle cell, or you have lupus, or you have multiple sclerosis, you really need to consider getting some type of protection. And the best protection right now is the vaccine. And the second point to that, I'll say one word: variant. Variant. That's probably one of the biggest reasons you want to consider getting vaccinated right now, because all of the data and all the protection is from the original virus. But these variants are just what viruses do. That's how they get by. That's how they make their bread. They mutate. And they mutate and they become more and more infectious. Right now we don't see any more serious in terms of hospitalizations and things like that. But those are going to be the people that are vulnerable, because the antibodies out there floating around right now are the ones probably to the original virus and not to these variants. So these variants are creeping. And right now, B117 is the biggest one circulating right now, and there's a problem for a different type of, I think, B147. I can't remember the exact number. B147 out in California. That's why they had such a hard time. They had a variant to develop out there, and as Dr. Phillips has said on previous calls, there's a variant that developed right there in New York area. So that's one of the reasons I would say to you, if you're not sure about whether I get vaccinated or not, one word you got to remember: variants.
Outstanding. And Dr. Boykin, let's go ahead and continue talking about the vaccine specifically. Now that we know Memorial Day is around the corner, now that we know a lot of jurisdictions have already said in the fall, schools are going to be open. Let's talk about the kids. Let's talk about getting our kids vaccinated. Right now, down to the age of 12. Can you talk about, youth vaccinations? Can you talk about, do you have to exactly be 12 if you're turning 12? And what if you've got a 10-year-old that is the size of a 14-year-old? Can you talk to us about the vaccinations for the youth?
No, we prescribe and ascribe to specific guidelines. If it says 12 to 17, you need to be 12 years old. You can't be 10 years old, because we don't have any studies that prove the efficacy right now. I mean, although they've been worked on in 2 to 11-year-old group, we don't have any studies say a 10-year-old looks like they're 17 will do just well. Physiologically, they're still a 10-year-old. They're not going to be a 12-year-old. And most 10-year-olds probably are early puberty or pre-pubertal, while 12-year-olds are entering puberty. So it's a whole different physiology going on there. So I would say they have to be that particular age group. Now, the biggest thing about this 12 to 17-year-old age group, particularly those kids that now have finished up elementary school and now going to middle school, because they are the ones that now are going to be in a different population. They're going from their little kids that don't have a great big chance of spreading the disease, but they do spread it, to a higher group. We knew early on in the studies that 9 to 10-year-olds had a higher rate of infectivity or catching the disease than those under 9. We know that. So now these 12-year-olds are going to be getting the middle school. And middle school is in preparation for high school. So they're going to be seeing some older kids in that population. So that's why we need to have those kids vaccinated. And if we want to really get back to where we wanted to be before this vaccine, we can't leave out that population, because remember, children may not have a serious illness as an adult in terms of COVID-19, but they can get it and they can transmit it, and they can transmit it silently. So that's very important why we need to get that vaccine. Now, the younger kids, the 6 to 2-year-olds, 6 months to 2-year-olds, already got studies going on with that. 6 months old have been vaccinated. So far, I haven't heard or seen any adverse effects from that. So, we still here? Okay. Yeah, those. I'm having some thunderstorms move through my area right now. I thought I may have knocked out my power. I apologize for that. So,
Sorry, Doc, you and me both. I was looking. I was like, yeah.
Anyway, at any rate, that's the importance of getting the kids vaccinated, because the other thing of all this vaccination of the young kids, we cannot forget what has been the impact of not being in school in person on these kids. That's probably the most important reason to get your kid vaccinated, because if they're vaccinated, they won't be a part of that circle of spreading infection in the community. So they can go, if they're vaccinated, they can go to school. The teachers don't have to worry about them spreading the disease to them, because the kids don't really spread it that much. They get it from an adult, give it to the kids, and it goes back to another person, other adults. The studies have shown. So if you get your kid vaccinated, you don't have to worry about that. You don't have to worry about missing a lot of time out of school. But most importantly, these little kids, these younger kids, can get back to the socialization skills that they need so much in terms of their development. Because, kids, isolated kids at home, we know what's happened to the adolescents. The adolescents had an increased incidence of suicide, emergency room visits for one thing or another, acting out, and other things perpetrated upon them. So we know that that's one of the importance of also of getting the kids vaccinated. But again, if we want to get back to where we need to be, or we want to be, and everybody's sick and tired of being in the house, and I'm just like one of them, but I got to follow the science. We got to include the kids as part of that circle, because we don't do that as a break in that chain, and that's where we can get another variant come in, or we have another surge of the disease. So that's very, very critical. That was a study, I guess to say a poll of over 700 well-known epidemiologists, and they said that was going to be the key to getting back to where we need to be, having the kids be vaccinated as part of that whole process. So with that, I'll see if Dr. Phillips wants to chime in with anything he might have to say about that. So,
well, I'm just going to use something you said before, which is, on top of this, we got to make sure we're on top of the preventive vaccination schedule.
Right.
Because unfortunately, you're seeing not just with the kids, but with the adults, the management of your preventive health has sort of fallen back as your situation has been disrupted by COVID. Your doctor's office closed and things of that nature. And again, to what we were alluding to, or what Dr. Boykin was saying, to maximally protect our kids, we want to protect them against COVID, but we also want to protect them against the diseases that have already been controlled by vaccines. So I think that's important as well, because again, if you are falling behind on this, it just puts you in a very fragile situation. All it takes is, you was around somebody who was with COVID and you got to go home 14 days. Then we see a whole nother, you could lose 6 months in the house again. And I just think that all of us need to be more preventive in our approach to our wellness, because as it was alluded, there may be another pandemic, there may be another surge. And unfortunately, the thing that we have seen is that our people, Black and brown people, have been the low-hanging fruit for in part, that we don't take advantage of preventive medical care. And we're more of a reactionary sort of approach to taking care of our wellness. And that reactionary approach for COVID-19 has made us the vulnerable population. And as we start to open back up and say, if you were that person that was lucky enough not to get COVID for this past year, but you got blood pressure or you got weight or something like that, don't continue to depend on luck. Start working on those things. If you have medications you're supposed to be taking and you didn't refill them, get the medications. Virtual medicine is a tool that is available to make sure not just the kids, but the adults, all of us stay on top of the preventive health, because the vaccine is here for a majority of us. We're waiting on it from the kids. So what are we going to do while we're waiting? Optimize your situation to the best you can, so that when that moment you can get the vaccine comes, you got it, and you can just keep moving along. As we're seeing right now, look at how the world has opened up to people that are vaccinated. It's been incredible. I mean, I think another thing that is important to talk about is I read an article and it was discussing as we open back up, anxiety becomes a little more apparent. And a lot of people are having some feelings of angst. But just because, I mean, if I saw you, Pofo, for the first time, do I hug you? Do I give, and we'll laugh about it. But what about those people that they're very mental and cerebral about it? Like, oh man, I don't know how to give somebody a pound, and then it just escalates. So, like I said, we may not be able to give you a pill to take that feeling away, but all of these preventive steps should give you a confidence as you step out there. As I go out and take advantage of the benefits of being vaccinated, I also do that knowing that I didn't skip any steps. So again, I think that preventive approach is what I would add to the children as we're talking about them particularly, but to all of us as we move forward.
So just to add on to that, I think a great thing that, we were early on when we were talking about the vaccines being out there, you couldn't get a vaccine and the COVID vaccine at the same time. But now the data says you can. So there's no longer a reason to not go get your pediatric vaccines or get your other, maybe your shingles vaccine or something like that, because the data does show that you can get these safely together. So the preventative part of it can go on, and you can still be vaccinated if you so desire for to get your COVID-19 vaccine. So kids that are behind because they didn't go for their health care, or adults that were behind because they didn't go for their health care because of being shut in or quarantined, whatever, can now catch back up on their routine healthcare, as Dr. Phillips said, and they can also get the COVID-19 vaccine at the same time. So there's no longer a reason that they cannot get it. So they can be protected anytime they want to and however they want to now in terms of the COVID vaccine, if that's what they desire to do.
I just wanted to add on because we keep bringing things up, so we add on. But what I wanted to add was some of the initiatives that some states are undergoing to stimulate people to getting vaccinated. Some states, they're giving out lottery tickets. They're enrolling you. I think Delaware has $1 million lottery. If you have been vaccinated, your name goes into a lottery system. Other states are offering vacations. Delaware, another state, is offering scholarships to some of the public institutions, the public colleges in the state. Savings bonds is something that West Virginia's been doing. And Arkansas has created a rebate on their fishing and hunting licenses if you're vaccinated. So again, I think that the bigger entities are recognizing what they could do to try maybe get someone to turn around and go, okay, I might try that now since I might get some money. Hey, whatever works, because at the end of the day, I could tell you some stories, but I ain't going, because we're a PG show. I could tell you some stories of the ways I've had to sell the vaccine to some people. But again, you've got to meet people where they're at. And if that place is a space where they'll, be felt and they'll hear you and they'll go get the shot. I think, again, as long as you ain't breaking the law, I think I'd rather go to an extreme to help somebody, because I can only imagine, again, what our fraternity brothers, that chapter, that brother's family is feeling right now, because he ain't here no more. He ain't here no more. And we are seeing that people are still dying from COVID. So if these are some measures, like they say, throw the kitchen sink, if this is throwing the kitchen sink and it gets one more person vaccinated, so we don't have to hear another story of tragedy and sadness, hey, that's what's up.
Man, that's right on time. Listen, certainly want to encourage all of our viewers, any questions that you have for the doctors, certainly if you're watching us on the Zoom, please use the Q&A so we can get your questions answered live. If you're with us on YouTube, certainly you can use the comment field there so we can get your questions answered. We certainly, as always, we want to give a shout out to our brothers and sisters of the Divine Nine. Thank you so much for your support. Dr. Phillips, Dr. Boykin, let's talk about, as things open up and as guidelines have changed, let's talk about the wearing of the mask. And let's talk about it for both vaccinated people and unvaccinated people. And specifically, one of the discussions that's come up is whether or not I need to wear a mask outside. Obviously, we're getting close to summer. You can see we got our polos on. We're ready for the summertime. Let's talk with this change now in the guidelines. If I'm around people and I don't know who they are and I'm vaccinated, should I still be wearing my mask? Am I okay because I'm outside? There's been different thoughts and philosophies on that. So please talk to us about that mask.
I would say to you, if you're outside and you're not sure, wear your mask because you don't know. Again, this is an honor system. However, if you are outside and you're in a large enough group, your chances of getting COVID are much, much less than if you were indoors with a group of vaccinated people. Because remember, circulating air inside is just it. It's recirculated. So if anybody has it, everybody in there just getting it. And they have done timetables and things like that to figure out how long it takes for you being exposed to you getting COVID-19 based on the number of people in the room and the time you spend with those people. They have always been done. But if you're outside, it's gonna, blow away, so to speak. Now, even if you are fully vaccinated, I mean, it's not a carte blanche. I don't have to wear. Because if you're fully vaccinated, you still have to wear a mask in a healthcare system. You can't go in a doctor's office or a hospital or anywhere like that without a mask. They're gonna tell you turn around and go back. And it has to be a specific type of mask. It has to be a surgical mask. It cannot be one of these masks with a vent in the side because they're going to take that right off of you and have you put on one of their masks. Public transportation, you still have to wear a mask. So it's not hey, I'm fully vaccinated. I can jump on the plane. I can jump on the bus. I can call what is it? I can't think of Uber to run me down to the store and you pick up something. You still gotta wear your mask, Slim. You just can't jump out there and say I don't have to wear my mask. So summertime. If you are outdoors, you having your barbecue or whatever, if everybody there is vaccinated, you're cool. But if you're not sure, particularly if you have a family that comes from another area that you don't know their local infectivity rate or their local things like that, and you're not sure, and they act a little weird to you, like maybe they got a sniffle, they got a cough. I said, wear your mask. I'm not saying you have to, but I say wear your mask. Now, first and foremost, protect yourself, because you protect yourself, you're protecting others from spreading the disease all around. So that would be my take on the mask situation in the upcoming summer. I don't know if Dr. Phillips has anything different approach he uses. So
no, I'm right with you, Dr. Boykin. And if you're not vaccinated, carry on as you have been. There's nothing changed.
Nope.
So like I said, I'm in New York, y'all in Virginia or in Virginia and Maryland. I'm scared for these next 2 weeks with this NBA playoffs, bro. I'm being honest with you. I'm just going to be, hopefully they'll be transparent with us if there's any incidents of cases. But, it's just, this is our really big first test to see if, again, because as I was talking earlier today with Dr. Boykin, I just find that individuals are trying to mold and meld the rules to suit their needs. If you're not vaccinated, you're not vaccinated. So there's no negotiating around that. And if you don't have a mask on, even if everybody else is vaccinated, again, you could still get sick. If you have not had COVID in this past year, okay, you may want to say I'm strong. I have a strong constitution. I would say you've been lucky.
And the question that we got in the chat, I think it's covered, but I'll ask it just so Brother John knows that we got your question. Air travel, specifically as it relates to air travel. What suggestions do you have for those of us who are vaccinated?
Well, if you're going to travel, you still have to, there's specific guidelines on the CDC's website for traveling. Domestic travel is fine. Some airlines may have a way of making you prove your vaccination status. I don't know, because we're in a pandemic, so all rules can be made by a local a business or whatever. But if you're going to travel, check out where you're going, even in the United States. Again, I hate to keep sounding like a broken record, but we don't know the local infectivity rate. We don't know what's circulating in that community. We don't know. So if you're traveling, just be prepared. Now, certainly, if you're going to go international, you got to travel. I mean, you have to check what's going on in their country. Obviously, no one should be traveling to India right now, unless it's a life or death situation within a family. They should be traveling to India, because India, unfortunately, not only do they have COVID, they have this new thing called black fungus, mucormycosis. And so, that in and of itself is going to be a big burden on that particular country with COVID-19 already. But then when you come back, you have to prove that you've had a negative test for COVID, or that you have been seen by someone that can give you a letter saying you haven't had COVID in the last 30 days or so. So that's if you're going to travel international. I would suggest it if you're going to be trying to do a whole lot of things when you get back. Domestic travel is okay. I mean, I would still, like I said, if I'm going to go anywhere where it's more than 20 people that I'm going to be up against, I'm putting on my mask. I even go to the grocery store, which is able to spread out. I put on my mask. I'm not going to take the chance. I mean, I know that the incidence of spreading droplets and things like on surfaces and things like that. Now, if you probably disinfected one time, you just wipe down the second time around. But we don't know when the last time those things been disinfected. They got to shut down a plane. If a case of COVID gets on the plane, they got to shut down the plane and do a complete disinfection all over again. So that's going to impact the travel. So if you're fully vaccinated, just be prepared that your flight may get canceled, your flight may be delayed or whatever because of needing to disinfect the plane. But you don't know. Again, this is an honor system. And I hate to keep saying that as well, but it's an honor system. There are going to be people on the plane. And how can you tell? Body language and behavior tells you more than anything else about a person. If you have a person, bristling all up and just about asked to put on a mask by a stewardess, more than likely they probably haven't been vaccinated. More than likely they haven't been. And I don't want to sound stereotypical, but the squeaky wheel gets the oil. And those are the ones that probably have not been vaccinated. Those are the ones out here trying to tell you that if a person's been vaccinated, they're going to give you the disease because they're spreading the virus. We know that's not true. There is no virus in the mRNA vaccines, so you can't spread the virus. You can get infected again with COVID-19, but your viral load, that means the amount of viruses in your body is pretty low if you've been vaccinated. And you probably don't have the same infectivity rate. That was one of the two things that the CDC opened up the country back up for, because they know that the vaccinated people spreading the virus is very, 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 very small. So that was one of the things that they used as an argument to open back up the country. Even though a lot of infectious disease people said they would have waited 60 to 70 days, CDC said, well, the data shows that vaccinated people just don't give people the infectivity rate as unvaccinated people do.
I think the other piece to add on to that is to just be accepting of the fact that you got to mask up. They said between April and today, they've had almost 500 incidents of unruly passengers on planes, where now they're readdressing the whole policing and security situation. So again, if you a person that tends to get emotional, go in there understanding you got to wear a mask the whole time. Vaccinated or not, you need to wear a mask anytime, as Dr. Boykin said, that you are in public transportation, plane, train, bus, all of those spaces, you need to be prepared to wear a mask. And again, I think the anger and frustration that we have seen, especially in that arena, speaks to the other importance of us just staying on top of our mental health. Because again, I don't think everybody's prone to bugging out, but I think that, pressure busts pipes. And if you're not opening that valve periodically to relieve that pressure in yourself, you rush into the airport, forget your mask in the car. Hey, I know I'm good. Come on. Pofo's coming for you.
Yeah. I wasn't, I'm trying to leave jobs out of it, but yeah, we coming full force. Let's do this last question as we prepare to get ready to close this thing out. Let's talk from the employee standpoint that's been home and is getting ready to transition back to the office, because as we start to open things up. Also, let's look at it from an employer's standpoint, right? What are some things that employers should be looking to do as the workforce comes back to the office, and those employees that have been home, they've been teleworking for the last year, almost year and a half. What are some things as they come back to the office from an employer standpoint and an employee standpoint that they should be mindful of as they go back to the office?
Well, first of all, I'm going to say, and I'm going to leave most of that to Dr. Phillips because he does a lot more practicing than I do these days. But first of all, you got to realize, what was the one statistic that we didn't see go up this year? Flu, because everybody was at home. But now that we're opening back up, people going back to work, you're going to see a rise in some cases of the flu. And flu is not out of the woods, at least when I was practicing. And I think some of the other brothers who are still practicing now, I gave flu shots all the way up until the July. I mean, in the beginning of July, I gave flu shots because, that was when we had the H1N1 outbreak, was in the summertime. So you're going to see more sore throats, more colds, more things like that coming. And you're probably going to, if you're an employer, you have to recognize that people are going to get sick again because they're coming back into a germ pool again of non-COVID illnesses. So, and if you are an employer, you got to make accommodations for that. You should be able to make accommodations for folks that want to stay home and telework. I think it's within their. I think it's reasonable that people will want to do that because they're afraid of getting infected. And at the same time, again, we don't know how everybody's. If you're going to come back to work, realizing that if you're unvaccinated, you have the potential of getting infected or spreading infection. Now, if the employers want to have those people in their space, that's up to them. But if they're going to be in the space with other people, then they need to be vaccinated. For safety of everybody involved. So.
Well, I'll add on to that. Again, I look at what we've done at Stony Brook. We actually just opened up fully, or it's been a gradual, but we should be almost fully open by July 1st. But we just started a scaled down return earlier this week. And I think the gradual nature of it is helpful because, as Dr. Boykin said, again, you've got people that have been at home. I think it's normal to expect that there's going to be some anxiety. There's going to be some awkward moments because, again, people have not been using the train or doing any of these other activities. And now they're going to be doing them. I think from the standpoint of the employee, you've got to make sure that whatever coping tools that you've developed during this pandemic, don't lose them. Don't lose them. Keep them going because, as I was jokingly alluding to earlier about just the lack of coordination when I see my brother and give him a pound, what about other interactions or things that people do in connection with others that go awkwardly? These are all things that can happen. And I think with that being said, those coping skills that we've all tried to develop during this time to deal with the stresses that have been plaguing all of us, we've got to make sure that we continue using them because it's going to be stressful going back to work. I think, again, you've got to have conversations as an employer to just make sure you check the pulse of your people and they know where you're coming from. I think one of the things that have really been helpful in us at Stony Brook coming back is that there's been constant dialogue between employer and employee, just keeping us up to speed. So with that constant updating, you feel like they're not going to leave me out there and have me not knowing stuff, But I also think that, each of us have to look at ourselves individually and what our own responsibility and liability is because, as I tell the people that work for me, do you need your job? I need my job. So I'm going to do things to make sure right now, because I don't have another job I can get. So I need my job. And I think, back to what I was saying earlier about that, I'm taking, a look at things for myself. I'm waiting and seeing, you've got to look at what your decision may do and how it may impact you. Because once you've made that decision, as we know, once that pen moves on, you can't go back. So we've got to make sure that, we prepare for these little rough moments or rough patches because they're going to occur. But I think, again, back to what Dr. Boykin said, we need this normalcy. I think all of us need a level of normalcy. And, for the people that don't want to do it, unfortunately, you got to keep running around here worrying about COVID. One of the things that I feel very confident right now about I could die from a lot of things in 2021, but I ain't dying from COVID. You know, I'm not dying from COVID, and I feel confident in that.
Dr. Boykin, give us your 1 minute closing.
Okay, thank you. Well, I just want to say to everybody out there, I think you should enjoy the newfound freedom if you're fully vaccinated. Enjoy that. I think it's certainly something that we have earned by being vaccinated. I think it's a privilege to have been vaccinated. If you're not vaccinated, I'm not mad at you, but please do your part. Wear your mask, socially distance, and wash your hands if you're not going to be vaccinated. Because remember, you can be a vector or a carrier and not even know you have COVID-19. That's the most important thing to know about unvaccinated people as well as vaccinated people to that degree. But you have a higher rate of infecting others if you're not vaccinated. If you're going to be unvaccinated and you want to do some of these things, just remember one simple thing you got to do: wear your mask. Don't give people a hard time about it, because that's the only way we can get some semblance of normalcy and some degree of doing the things we want to do. You know, restaurants are opening back up. Some of them open back up 100% capacity, but they have their own rules and regulations. So be prepared to follow the local and state regulations for your particular jurisdiction when you go back. But please consider getting vaccinated so that you can enjoy the privileges of being fully vaccinated and do whatever you wanted to do before you were before COVID-19 came around. So think about that. Mitigation, vaccination gives you a whole lot more freedom than not mitigating and not vaccinating. Thank you.
Thank you. And Dr. Phillips, in your 1 minute, if you can, I see one of the viewers that's online. They're on the fence about the vaccine. They just happen to be a firefighter, but I see him on there. He's on the fence. Do what you do, Dr. Phillips.
Well, you know, again, as a servant of the community, you are in a position where you are constantly exposed to the potential of getting COVID. And as a person who is in the business, and you would come and say, hey, doc, I got COVID, I'm a fireman, I would look at you and say, well, why would you expect yourself not to get COVID? And as we have seen earlier this week with, again, the loss of our brother, we've seen a beautiful family get a vital part of that family taken away. So again, I think it's critical for us to recognize, not just for this moment, but looking at how this moment had a big impact on what 2020 was last year. How we handled Memorial Day weekend going into these next stretch of holidays really had a major say-so on the rest of our year. So again, y'all, if you're not vaccinated, ain't nothing changed for you. Your risk are the same as if they were January 13th, 2021, when we lost 3,555 people. Your risk is the same as it was on that day. So protect yourself. For those that are vaccinated, again, in moments where you understand and have an idea of what's going on and who you're around, if it's one of those safe scenarios like outdoors, enjoy the mask-free existence. However, if I'm going to the Knicks game, I'm wearing a mask the whole time, and I might stand not in the seats, but I might stand in the back. But again, my point is, this is not over, y'all. This thing is still here. This thing is still out here waiting for you to get laxed. And when you do get laxed, and unfortunately, you know,
bam,
we see what happens. We know what happens. And to my brother, the fireman, I appreciate what you do, man. You know, what you guys did in 2001 in New York at 9/11 was tremendous. As a doctor right now, this is how I'm looking at it. This is my 9/11. And this is how we as medical people step up, not just getting these shots, but also, again, compassionately listening. And as I said, brother, if you were to get COVID with what you do, I would look at you and say, well, why didn't you expect to get COVID? So with that being said, I thank you again for the opportunity, because I do feel that this conversation, even though it's ongoing, is still just as important as it was in the beginning. Thank you.
Absolutely.
Dr. Boykin, Dr. Phillips, as always, thank you so much. I certainly want to again acknowledge our brothers and sisters of the Divine Nine. Thank you so much for your support. Also, our partners, with Omega Psi Phi, certainly the American Red Cross. If you have not donated blood, certainly do your part. Let's give back to the community. The National Kidney Foundation, another partner of ours. Please do your research, log on to our website and assist with our National Kidney Foundation. Also, we have an HBCU initiative that we're doing. We're trying to help support our HBCUs. So please log on to our fraternity website, make a donation if you can. Also, we're continuing our sponsorship with Assisting St. Jude. To the brothers of the mighty 2nd District, I thank you for your support, your re-election, and I hope that all of you have a wonderful Memorial Day holiday. Please stay safe. To all our guests this evening, thank you again for joining us, and we'll see you in due time. Also, a shout out to Brother Worley, he's spinning the records through our Microsoft Teams. Shout out to Brother Ed Hill, and certainly our engineer, our producer, who's bringing all of this live to you, Brother Piercy. We appreciate you all, and Brother Piercy, you know how to take us home. God bless you. Stay well.
I like this part right here. Come on. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the on. Till victory is won. Now we add a little something to it. Just to encourage you. We're going to take you to church later. Let's go. We'll keep marching right until the victory is won. To all my brothers out there. Hold your head up, brothers, till the victory is won. To all my sisters in the struggle. Keep believing, sister, till the victory is won. Till that day. Till that day.